Welcome back to the Dr. Mo Show, Freedom to Shift, where we talk to doctors and other professionals who are in the medical space, especially about how they have shifted, how they have turned their careers to sometimes very different areas. Today I've got Marissa, who is a friend for quite some time now. Genius. But first, your shift story, and thank you for being here.
Well, thank you for having me, and thank you for being willing to put up with me on this day because I actually come to you from Northern California with a cold in my nose. So I am doing my best here, and I will probably make a few mistakes, but bear with me.
Mistakes are reality, and I'm all
Yeah,
about mistakes.
no, this is real life right here. So yes, so we were talking about. Well, first of all, my background, yes, I am a flight nurse and I still do work part-time. In fact, I was on the schedule for Sunday and I cut out early because this cold was hitting like a freight train. And so I came home. But I still do work a little bit doing that on a part-time basis. And then I have shifted away from that to trying to really unpack and examine what decision making is about. Because, as you understand, as an ER physician, often under pressure without all the facts at hand, you need to make decisions about your patients, and you have to make them rapidly and you have to execute them well. And the objective, of course, is a good outcome on the other side. And that is not different than what a lot of people face in their daily lives. They often don't have all the facts. They often don't understand how they're going to proceed, and they still, yet they want a good outcome. And when I started thinking about, well, what makes the difference for us when we are in healthcare versus the other rest of the world. And there are two significant differences. One is in healthcare, we spend a lot of time in study. We study, that's the scientific method. We apply that. We study and study and study. And we calibrate according to the results that we get. Well, so the general population doesn't have that. But the other thing we have in medicine that works and has worked as long as it doesn't get interfered with, is a decision making process where we gather information, we analyze what it means, we form a diagnosis, we apply a remedy to that diagnosis, that the outcome for which we know what our objective is. We're trying to restore the patient. We're maybe trying to restore some blood pressure or a heart rate or get the fever to go away or whatever it is. So that process is a process that anyone can learn and use. And I think that if people could understand that and use it in their daily lives, they would probably have a lot more satisfaction. It would clear up a lot of the mental mess and it would help them to proceed. And I've had nurses or other, was it a medic? I don't remember. Anyway, somebody come to me and they were struggling over a decision. And I looked at them and I said, why don't you just apply the same process for decision making to this that you do clinically? And he looked at me and he was like, what do you mean? And I'm like, well, do you not need to gather information? Do you not need to analyze its meaning? Do you not need to form a plan? Do you not need to execute the plan and rerun it or fine tune it and adjust as you're going like you do in medicine? And he's like, yeah, huh. And I was like, yeah, huh. So I feel like if that can be the effect it has on a colleague, that can be the effect that it has out in the world. And indeed, it's true. I wrote my book, and I've had, one of them was one of the advanced reader copy recipients. He worked through the manuscript and gave me some verbal feedback on it, which was helpful. And then he came back to me later and he said, thank you for that book. Actually, my wife and I used it. We used some of the ideas out of your book to help us make some decisions about moving and relocating and making some real like significant choices. And I was like, wow, well, you're welcome. I'm glad it helped. And I've had other people come back to me with similar bits of feedback. That's what I have shifted to. I was trying to examine. And then the other day, I watched with lots of interest, and I'm gonna have to rewatch it again. an episode of a podcast done by a psychiatrist that I really respect. And he was looking at the elements of decision making. And he was starting to unpack how dynamically good decisions are made because you have a healthy mindset. Your mind is healthy. And when your mind is healthy, it directs your brain appropriately and accordingly. And out of that is driven good decision making. So it's a concept that's catching hold. It's gaining some attention. People are looking at it, and I know that a lot of us had experiences growing up where our parents or grandparents, teachers, whatever, said things to us like, "Well, if you would just decide better. I mean, if your friends are going to decide to jump off of a cliff, are you going to follow them?" Well, that doesn't really help.
Well, it
But
depends. Is
giving
there water at the bottom? Am I having fun? Am I in a
exactly,
swimsuit? There
yeah,
are a
what
lot
am
of
I
things to
landing
unpack
on?
with that.
Yeah, what am I landing? Do I have a parachute?
Right,
Yeah,
right. Like there, but again, that's how we think as trained healthcare providers, right? Like, oh no,
yeah.
no, wait, let's gather that. Like, hold on, we have questions. But the funny
Hmm.
thing about that, when you say that, my brain just kind of sighs a little bit. My body sighs a little bit because we just had a staff meeting, for example, and the way the company organization is going, it fits right in with that because we were talking about, right now you're having to make some decisions for a family medical practice that management is not easy and having to make these decisions. This isn't, running a company of any sort, especially one in healthcare. It takes decisions. And when you interject drama into those decisions or emotion into those decisions, it is number one, like you said, not a healthy mindset. You need to look and I am guilty over and over at not removing the drama. Which means like that should not be my role, right? Because if I can't do things for the betterment of patient care, that should not be my role. I do plenty of other really good things. Go there, make those decisions
Hmm.
and have protocols for the decisions that and it's not like I don't hurt patients. That's a no-brainer. But it's just a like you said, we were talking about this that you elevate yourself into the place where you're making the decisions that you are good at, other people can't make.
Right. Yeah, we're all gifted with different places of decision making, and that's why you rely on and you call on the people whose giftings are different than your own and whose maybe, and so therefore maybe their purpose is different than your purpose within the same organization seeking to achieve the same goal.
So here's a question for you. For my listeners, the doctors that find me, and it's doctors, it's dentists, it's veterinarians, it's sometimes lawyers that are like, yeah, but this is applicable. It actually is. So for the doctors who find this podcast and they're making a decision to start, because I help them start remote ventures that feed their soul, really. But that doesn't sell, to be honest. The good news is it also replaces your paycheck. When they're making a decision to start something and develop their voice and get out there. And now I am not a fan of burning the boats. I didn't even drop shifts until I was making 2/3 of my income. And then I dropped like 2 shifts. I was like, okay, that feels safe to me. I am a weenie when it comes to that. I'm not a burn the boats fan, which probably also makes me not make critical decisions quite as well because there's not as much of not a fire under my butt, right? But here's a question for a doctor who's sitting. I'm going to play devil's advocate here. And they're like, yeah, but I just don't have time during the day, to put 30 minutes or an hour a day into creating this new thing. So I'm going to, by not deciding, I'm going to put it off. I'm not going to decide. Instead, they make a decision, right? Like the Rush song, just a decision not made is still a decision. So they
Right.
decide not to move forward, not to increase their autonomy and impact as a doctor, and they decide to sit in the same situation they've been in, and however miserable that is or was, or for whatever reason. Sometimes it's not even miserable, they just need a little decompression. But what would you say to them on that lack of decision really being a decision?
Well, I think I would personally, if I was talking to them, I would ask them in their current state, what are the prices that they're paying in their current state? Evaluate evaluate the deficits that are mounting in your current state. because it's not, I don't think it's a question of if they are experiencing those things. I think they are, but maybe they haven't inventoried that quite well enough. And so I would be asking them, what are your current deficits? And then let's look at the current projections on the other side. What do you think you would, what would you project at getting in return for making a shift, for changing your decision, changing your direction? Would those benefits outweigh the current deficits that you are experiencing? Because, and isn't that what we do in healthcare a lot? We actually understand that there's going to be a medication side effect that could be undesirable. It could be kind of uncomfortable. However, the benefit of whatever will be experienced on the other side of that is outweighing any of the other downsides. So I think that's the question. What is it that you're currently accumulating in terms of deficit that will be outweighed if you make this change? Because you doing nothing is just going to continue to rack up all those deficits that you're living with that are subtracting from your soul. And how long is that sustainable for?
Well, until you die for a lot of doctors. I mean, I'm going to just call
Well,
it out.
yeah, unfortunately, that's the case. And those are avoidable tragedies, in my opinion. Those are talents that can't be lost either,
Yeah. We need them
because
on the ground.
exactly, you're so valuable.
And we need
And
them at home.
that's, yeah,
We need them. We need doctors. We need them on the ground. We need them at home.
yes, yes. And I have grown increasingly concerned. Back when I was a brand new baby nurse, the value on physicians, particularly, was so much greater than it is now. And I have watched with dismay how that has actually taken a steady downhill tumble. And it has a trickle down effect to everybody that they contact. And physicians do have a lot of contact. And I can't think of a worse idea, really. I mean, I don't think that doctors need to be cultivating some of the God complex that has gone on, but that's not what we're talking about. We're not talking about a God complex. We're talking about value, actual value. And their actual value is extremely high. And when they get treated by hospital corporations like they are not valued, but rather just one tiny pin in a cogwheel, it doesn't have a good effect on them morally, spiritually, and functionally. They they can't function in that situation and thrive and grow. And they need to be in a situation that they can thrive and grow, because when they are, the people around them are too. The nurses, therapists, all of the other pieces of the whole organization will thrive and grow. And I have seen firsthand the carnage that's wreaked in a community when the ER group, specifically the ER group, is decimated. It happened in my local community, and it was a terrible thing to watch and a terrible thing to experience. And the outcomes have been exactly as predicted when all of that started. When all of that started, we all got together and kind of fretted and worried a little bit, like, wow, if the specialists realize that they cannot consistently connect with a stable ER group, they are not going to be here. And guess what? They're not here because the ER group has gotten so unstable. And so, I mean, just for your specific discipline alone, I see the point. But I mean, I see it for other disciplines as well. I'm not limiting my view to just, it's everywhere. And let's take into consideration those specialties. Like if you have a neurosurgery subspecialty, they want to know that they have a good collaborative, consistent relationship with their ER. If they know they don't have that, Do they feel confident in practicing at that hospital? Maybe not, because what if afflicts the ER group is also afflicting the OR? What if
Yep.
the
And
anesthesia
then
group
I was
is,
gonna say, then it goes to the ICU, and then it goes to anesthesia.
exactly, exactly, exactly. So when their entry point in the health system is the ER group and it is fractured, it just portends all kinds of badness for the rest of.
So here's an interesting question on that, because I have had opposing opinions by different upper level management offered to me that a stable ER group means only full-time emergency physicians working. Where I believe, and I've heard this from others as well, that a stable group in the ER is staff that is happy, thriving, healthy, knows the system, may not work full time, and you may have 3 people handling one full time job, but it's the same people. To me, that's
Right.
still stable.
That is still stable because you still have the known actors present. When you don't have no, like if you have locums in every week, different ones, and they may not consistently serve the same contract week in and week out, then now things are getting unstable. And that's what's happened in my local community. Now, I think there have been steps taken to remediate that, and hopefully they continue to take them. I hope they've learned their lesson.
Well, even if they have the same locums team coming in all the time, that's even stability because,
Well, even that, yes, but it has to be the same team, and so sometimes that's not always the case. Anyway, I know that just in my own personal observation, it has been a tremendous source of destabilization to go after an ER physicians group, and then also to indicate to them that they aren't worthy of the same amount of value as any other of the specialties. Emergency medicine, EM, is a specialty completely all its own with a whole lot more unknown variables than what you're ever going to get in ortho or neurosurgery. I'm sorry, it is.
and that's the thing, it's also been a specialty for 40 years now, so we should probably get over that.
Right. And the value needs to be reflected accordingly. And that's what has been missing. So anyway, I and I know I'm preaching to the choir here because I mean I've been an ER nurse and ICU too, but ICU things are a lot more known. They are because that patient has been oogled and ogled and studied thoroughly before they hit the ICU. But in the ER, that's not the case. And they may present to the ER as an immediate ICU case, right? And so you have to figure all that stuff out instantly.
So it's funny because I think that that creates like emergency physicians, acute care physicians, shift workers, right? That's why I call it freedom to shift, right? You can pick. If you want to keep working another shift and trade time for money, that's your prerogative. However, shift workers I think are extremely valuable in the world of having a voice for other people, because if you are a coach or a consultant or do a telemedicine practice, I mean, think about telemedicine, urgent care. Let's just take the easy pick of the litter.
Mhm.
When you're in the ER and you've got 40 patients in the waiting room, you're reading triage notes. Guess what those are written? You're not talking to the patient. You're reading a triage note and you're triaging based on the notes that are there. Tell me what asynchronous telemedicine is again. Oh, that's right. You're reading. Hey, here's what this is. And you're like, I
Mhm.
can name
Yeah.
that in 3 notes.
Right. 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 Right.
And sure, you're still going to talk to the patient when you get there. But it primes us for making decisions. And people are like, well, I don't want to own my own business. Okay, well, I'm not saying you have to become, Tony Robbins. Like you don't have to own 121 businesses. And I know that's gone up probably exponentially since I heard that number. But you don't have to own 100 businesses. I'm asking you to have a voice, because that gives
Mhm.
you the autonomy of what do these people, when people come in, I've talked to a few cardiologists lately. And, when people come into their office, like my own cardiologist. has a website with a whole bunch of preventative care information. Wouldn't it be cool if he had a coaching group, a cardiology prevention coaching group where his patients could pay a small fee or whatever to come and talk to him once a week and ask him questions, not as a doctor, just as, hey, let's do some prevention. So that way you can get that information out. You have voice. Or you just throw it on YouTube for free. I don't care. The whole point is all of that information helps everyone. And it helps you get back that sense of autonomy, get back that sense of value, because now you know you're providing value. And I know when you're in a trauma, when you're on a flight, when you're in the ICU, when you're in an appointment, you are providing value, right? But that's one-on-one. And that is, for me at least, over time became quite emotionally draining because
Hmm.
I'm very empathetic and it's hard for me to do that. But when you learn to protect your time and energy and use it in ways that are actually more valuable to people, then the dust clears, you can make some decisions, you can make a decision, right?
Right, right. Well, and that's kind of what my work has been, is to try to help people realize, look, you can clear up this mayhem in your mind a lot if you just apply a process and then trust the process to work. It will work, but it works because you work it. You put it into, you don't just allow things to happen. Well, I'm not going to decide about that. I'm just going to allow, okay, well, it could get a lot messier than you anticipated. I hope you're prepared for that, and a lot of times people aren't. And I mean, both of us, you and I both, have built entire careers off of terrible decision making. Not ours, but the terrible decision making of other people out there. And you wondered to yourself, and you've probably even said it out loud, well, what made you decide to do that?
Seemed like a good idea at the time.
Yes. And how many times we've been told that. And how many times we've confronted those here, hold my beer moments that turned out really terrible. No, I've had plenty of them. We're about on the cusp of the next holiday of the year where we're going to see a lot of hands blown off, a lot of shrapnel wounds, a lot, you know, from people that thought it was a good idea to, get creative and inventive with their explosive devices on 4th of July. So that wasn't what the family or what the founders of our country had in mind when they
Probably
founded
not,
this. No,
right?
no, they
No.
didn't. But yeah, so what I'm saying is, after watching people for decades now make decisions that really go wanting, I am like, okay, we can do better, but I think people don't understand how. And kids these days, this is where things got really kind of real for me, is watching young people struggle along having no clue about how to make a good decision. And I've asked my niece, she's a teenager and she's in school right now. She read the, you know, intro and a first chapter or something like that of my book. And I said, well, what'd you think? She goes, man, this is really good. And there's stuff in here even I hadn't thought of. And I thought, oh, well, that is shocking at the age of 15.
Because she knows everything, so yeah,
Well, all
absolutely.
teenagers do.
Right?
Anyway,
That's my
yes.
job anyway.
Right. I said, so how much of this do you guys get in school? And she goes, none. And I was like, none? And she goes, no. I said, do you get told what you should decide all the time? And she said, yes, we get told what to decide, but we never get told how to arrive at that conclusion.
Yeah. There's no
What is,
frameworks. It's all
there's no
reactive.
framework, there's no process, there's no methodology, there's nothing that they get taught in that regard. They get taught what their final conclusion should be. And she's like, I might not always agree with that. And I'm like, well, no, you might not. And she goes, so I mean, this is great to have this like method. And so that's what my book is. It's not fluffy, it's not fancy. It really isn't like what you're going to sit down for an enrapturing read. That's not what it is. What it is it's like a guidebook, a field guide for making decisions. Like, where do I apply this? What do I do about that? And I want to bring our conversation back around to emotional decisions. So there is a place in it, and people think there's not a place in it in, medicine and stuff for decisions regarding that are emotional. There is. And it's that subjective data collection piece. That subjective data is where the emotion lives in a decision. And so I don't want people to think that I am telling them to discount their feelings. I'm not. Just don't let them rule the day, okay? Because they can. And if you let them, they will gladly rule the day. And you can't allow that. A study, I guess, recently out of Harvard, I need to look up more thoroughly because I don't have all the detail on it. But I guess there was a study done at Harvard, and they looked at decision making and discovered that 90%, over 90% of Americans are making decisions on emotion, emotional decision making.
Mm-hmm.
Well, then when you look back at how society is functioning and things are so sick and wrong a lot, should it be shocking? No, it's not shocking. It tracks. Yeah, I guess I agree. 90% of decisions are emotionally made around here because look at the outcomes. So we can do better. That's the thing. That's the thing. Our mad skill as humans, we're the only mammal that has this, is the ability to learn and grow and change and shift from a bad decision making process to a good one. We have that ability because we're humans. And I would like people to embrace that and to really grasp it because we're not seeing it so far. We've seen it in bits and spurts and flashes along the way in our human existence, but as far as being a consistent normative experience, I don't think it's there. I don't think it's there.
I can't agree more. We're just so used to being reactive, soothing the moment. So, as I want to respect your time and the listeners. If someone hears this and says, "No, I really would like to live a more proactive life rather than reactive to everything," because that's what we do, right? We run our lives like a trauma. I just wrote an article on that last week.
A
We
lot of
we run life like a
damage
trauma.
control.
Right? Because we think we can control it when we know we can't. We just do our best, right? Just get the airway. So, but if someone says, no, reactive, when you realize I'm living a life based in reactivity, whether it's, your parents' viewpoint of where you should go in your career, where you think usually it's internal voices. I mean, I can blame it on parents or whatever, but by this point we're adults. We've internalized this. Own this. It's your responsibility.
Yep, yep, absolutely.
But if someone wants to shift from reactivity to proactivity and says, I don't know how to make decisions, where do they find you? Where do they find your book?
So my book is on Amazon. The title is Decide Your Simple System for Getting It Right the First Time. And I I'm not clever enough to put up a graphic that has the QR code that takes you straight to the book. But
We'll put it in the
that's
show notes.
okay. That's okay. Yeah, I'll get it to you. And the other place you can email me at any time if anybody has questions, wants to just shoot the breeze about something, shoot me an email. wiselife@wiselifestrategies.com. My website is up, but it's not great. I am working on it. I'm going to make some changes to it. So I'm not really recommending people go there. However, if you want to find me in another platform, look for me on LinkedIn. And you'll look for me under my name, Marissa Johanson. And I'd be glad to field any questions or discussion on LinkedIn as well. And yeah, I think that a lot of us can do a whole lot more with our ability to make sound decisions because it is foundational and so impactful for everything else in life. I mean, it really all does rise and fall on the quality of your decisions.
Totally. And if you choose if you choose not to decide, you still have made a choice. So let's
Absolutely.
just take control of what we can, which is very little in this world. Be proactive and stop playing whack-a-mole with the things and make some
Right.
decisions. Draw
Right.
some lines, create
Yes.
your life.
Yes. Yes. I agree. I
Absolutely.
completely agree.
Well, thank you, Marissa, for your time today. To the listeners, thank you for your time and attention. And we will see you next time on The Freedom to Shift.
Thank you.